Hey everyone, what's up? It's Dr. Charlie Johnson here, physical therapist. In today's video, I want to talk about disc herniations, kind of what you need to know. I hopefully want to make this whole thing you're going through a little bit less scary. Also, I'll give you some hope. So this video is actually inspired by a conversation I had with a woman recently who is dealing with a disc problem, as well as a message that I got from one of my followers that sort of ticked me off and was the catalyst to creating this video. So again, I created this training after chatting with a woman who had suffered with sort of back pain and disc problems. She was shown her MRI of a really bad disc herniation 15 years ago. She was in a lot of pain when I chatted with her and was sort of worried sick about her diagnosis. She was told things like, hey, you're gonna have to live with this thing. It's never going to get better. It's only going to get worse as you age, because that's what happens, right? The body degenerates as you get older. And this is just totally not cool and also not true. So I want to break this myth. I know that I did for her, and I opened her eyes to an opportunity for healing. She had a lot of questions for me, right? She said, hey, what did the results of her image years ago show? Would she need surgery? Would she really have to live with this? Because that's what she was told by someone who she trusted, a spine specialist at that time. She also wanted to know, hey, Charlie, do you think you can help me in that? Can my disc heal, or can my body heal naturally? And if so, how? And how are you going to help, right? So these are all great questions, and I want to take a moment in this video to share with you what I shared with her in hopes of, again, sort of making this a little bit less frightening, easing your mind as you move forward and you try to heal this disc problem or this back problem or whatever you're going through naturally. So check it out. By the way, if you're new to my channel, again, my name is Dr. Charlie Johnson. I am a physical therapist and an orthopedic specialist. I help people with back, butt, and sciatic problems all over the world by teaching them essentially how to fix themselves. So if you want to not have to rely on someone else to fix you, if you want to learn to assess your own body, tune into and attend to your own body and figure out how you can resolve this pain problem on your own using the mind and movement, then check it out. Stay tuned for this video, as well as check out some of my other stuff on my channel. Also, look, one of the big things we'll chat about here is this idea of like images and the utility of them. And are they useful for disc problems? Are they not? What do they mean for your recovery? And so if you want to avoid getting an MRI, but you're like, hey, what the heck could be going on? I recommend that you check out my DIY diagnostic guide. I call it DIY better than an MRI diagnostic guide, because I truly believe that there's nothing special about an image. Most of the times you can clinically pick these things up by going through a good movement exam, listening to your story if you have someone that listens to you, and sort of checking the boxes. So check out that guide. Again, it'll be linked above here if you're interested in figuring out what could be going on. So let's jump right into it. Okay, so let's talk about disc bulges and herniations and what you need to know. So in this training, we're going to cover why x-rays and MRIs aren't recommended for most disc injuries or back problems. Instead, I recommend my DIY better than an MRI diagnostic guide. It's going to give you everything you would want to know about back problems, essentially. So check that out. How the size of the disc bulge impacts your ability to heal and your chances of needing surgery. A lot of people are like, hey, I've got this bad disc herniation. That's not good. No bueno, right? Like, can I heal from this thing? So I want to talk about, again, how the size of the disc herniation actually plays into your ability to naturally recover. I'm going to talk about theories behind how discs heal naturally, if they do, right? And what this all means for your recovery or getting better. So to kick things off, I want to start with a few images. So real quick, as someone with a back, butt, and or leg pain problem, sciatica, if you want to call it that, how do you feel when you see these? So some flashbacks maybe for you if you've had some images. Right, so you can see here, large disc herniation in the low back. This is from one of my actual clients. Another disc herniation. You can see it circled here. Right, so how do you feel when you see those things? And what do you feel and think when you read or hear this? A pretty standard MRI report. You can see here, I've underlined the impression, sort of the summary of the findings. Interval development of stress, reactive marrow edema involving T12 right anterolaterally. Do you even know what that means? Multi-level DJD, degenerative disc disease, or DDD, degenerative joint disease, or DDD, degenerative disc disease. Sounds good, right? Worse to L3, L4, and L4, L5 with severe central canal stenosis or narrowing. notably at L4, L5, similar to last examination. This person apparently had an MRI exam prior. It probably sparks some type of worry, fear, or anxiety if you're a human, right? And this is normal. So chances are all sorts of thoughts and emotions pop up. You might be asking yourself, will I need surgery? Will I ever be able to, get back to the activities that you love? Maybe it's just, maybe it's playing with your grandkids, or maybe it's tennis or pickleball, or I don't know, ice hockey, or just the gym, whatever it is. You might be asking yourself, hey, is this the end for me? And you may have seen me mention in my previous videos about how pain is an experience created by the constant interaction between both your brain and your body. So these things that start off as just these physical entities like, oh, I hurt my back, right? They eventually sort of become a mental draw on your mind. And you can actually learn to become in pain because there's this constant communication between, hey, I do this thing with my body and that hurts. And it says to the brain, hey, you might want to be afraid of that thing, right? And then it tells your body, hey, don't do that. And the cycle just sort of spins out of control, and it becomes a negative feedback loop that you get trapped in. So many people start off their quest for pain relief by believing they first need to figure out what's going on. And the most common way to do this is an X-ray or an MRI, right? Again, I'm telling you, check out the DIY diagnostic guide that I provide. It's completely free. Put a ton of time and energy into that. And I think it will help you out and save you a lot of time, energy, fear, concern, as well as money, because these images aren't cheap either. So, and this makes sense, right? It's like, hey, I got to figure this thing out, and that'll sort of tell me what to do, right? And this is the world that we live in. But the problem is that what you see and what you hear cannot be sort of unseen and unheard, right? So your memory will fade with time, but like a train wreck, you'll replay the experience over and over and over again. So you might forget the exact details, but you'll know there was some negative stimulus there, right? And the experience just lives on. It wasn't a good, happy, joyful experience. It was probably something that's bad as you were sitting there, getting this X-ray, getting this MRI, right? Having it slapped up on the screen for a few minutes while the physician leaves, right? And then comes back, and you're just staring at this thing, asking yourself all of these questions, a lot of negative inputs there. So evidence clearly shows, though, and my experience absolutely confirms this, that people who get X-rays and MRIs actually do worse than people who do not. So the same disc problem, degeneration, stenosis between these people, but people who get an image have a harder time getting back to normal and escaping the pain experience. And there's plenty of research to support this. So you can see here, appropriate use of diagnostic imaging in low back pain. A reminder that unnecessary imaging, because most of it is, may do as much harm as good. So is it because the people who, get the images, they heal more slowly than the people who don't get the images? No. It's because seeing and hearing the results of their image heightens the pain experience, traps them, or maybe you, if you've had this, in fear, gives them credible evidence, right? It's something you can see. It's literally in black and white. We all love black and white. So it's in black and white. Maybe it's done like that on a purpose. I don't know. But it gives you credible evidence to believe that you are broken or that something's wrong with you, right? And this holds you back. It literally brands or stamps a diagnosis or a problem on your subconscious, right? And becomes self-limiting and thereby keeping you from healing. So it shifts the mental state from one of, oh yeah, this hurts, but I'll get over it, it'll go away, to, oh shoot, right? There's no way I can fix that. Did you see that thing? I can't fix that. And from the moment that switch occurs and that belief gets planted, the person in pain becomes indebted by the very thing which they thought would help them figure it out, the X-ray or MRI, and was going to lead them to relief, right? So we have this problem. We think, oh, I need to figure this thing out. So we get an X-ray or MRI, and that thing which we think is meant to help us and free us and lead us down the path of solving it actually acts as something which ties you down and restrains you, like somebody pulling you back, right? Or holding you back. So instead, right, it misleads you down a path of fear, worry, and frustration, a rabbit hole. And it kickstarts the negative feedback loop, right? So this is actually a thumbnail that I blew up from a physician on YouTube. I won't mention their name, but they talk about reading X-rays, MRIs, and this is a thumbnail, right? And here you go. See the big disc bulge where the arrow is pointing to. They say, this is bad. And this is usually what they tell you, right? If you're in the office, they say, this is not good. And you've got that image, and it kickstarts this this negative feedback loop, this pain catastrophization cycle that keeps you trapped in pain. And it strengthens it like a hurricane, right? Going back over water, it strengthens it. So you begin to worry, you start to have fear, you start to have anxiety, right? And that we call that pain catastrophization. You start to worry about it, you start to ask questions about it. And then you become hyper vigilant about solving the problem. Maybe you're here on YouTube looking for a solution, right? Maybe you call your friends who have had similar problems, or you call other physicians to get a second opinion, whatever it is, right? You become hyper vigilant about it. And because of what you saw and been told this is bad, don't do this or do this, right? You become avoidant of certain things in your life for fear of making it worse. And then as you become avoidant because of the fear that you have inside of you, you start to disuse things, right? Because you're not living life. You start to maybe enter a state of depression or discouragement and start to wonder if you're ever going to escape this. And that feeds the pain experience, not in a good way. You can see the kind of angry red face there. But really the solution is to break from that cycle, from that negative feedback loop, to extinguish any fear over time, to confront any fears or concerns, which I'm helping you do right now by letting you in on the truth about these problems so that you can escape it and recover. Weird stuff, right? So why do I show you those images of massive disc herniations? To scare you? No, of course not. That's not my goal. I'm trying to reverse that. I'm trying to put your brain in a state of more safety than threat, because right now it's threatened by that which you've seen or been told or believe, right? It's just the opposite, to free you. And I want to let you in on something that's been super powerful, especially for the woman I chatted with earlier, as well as some of my other followers who are dealing with these things. The larger and more severe the disc herniation, the better your chances of natural recovery. Pretty crazy, right? So let me explain. Right? So the larger and more severe the disc herniation, the better your chances of natural recovery. So just let that sink in for a second. So you saw when that person, right, that doctor said, hey, this is bad. And maybe you remember sitting in the MRI room, or maybe you're headed there and I'm telling you, hey, check out my guide first, right? That is not bad. It's unfortunate. Yeah, nobody wants to deal with something like a bad injury, right? But it's not bad. Actually, the worse it looks, the better your chances of getting better. So let me bring you up to speed on what we know. Okay, so there are three main types of disc herniations. I think we should just chat about this really briefly so you get an idea of like what we're even dealing with. So here they are and explained from least to most severe. So disc protrusion, some people call this like disc prolapse. And you can have kind of a focal or a local one if you want to call it that. We'll talk about what that is. A broad-based one, a little bit wider. A disc extrusion and a disc sequestration. That name just sounds bad. So here it is. I did a little drawing for you. This is the spine from the side. So you have the bones in the lower back. You actually have 5 of them. So you have L1, L2, L3, L4, L5, and then you have kind of some sacral bones. All right. But at the end of the day, L4, L5 is like basically the most common level of disc herniation. So you can see that there's the disc sort of in that blue area. Most people have kind of heard discs referred to as like jelly donuts. Think about however you want. I don't love that analogy. We'll talk more about that later, but there it is. Okay. Like a little bubble or a ball bearing. And then you have the spinal cord, kind of that vertical yellow thing running on the left side. And then you have like that little bulbous kind of thing that comes on out like a branch off of a tree trunk. And that is the nerve. And those nerves come together as it relates to the low back in the buttock and go down the leg. And this becomes essentially the sciatic nerve. And then you have the bones, right? So L4, L5, those are just the vertebrae or the bones. And then that red arrow kind of shifts us over to essentially, if we were to take that spine, vertical spine, and kind of lop it or cut it in half and open it and look down on it. So now it's like you have a tree, you cut it in half and you're looking down on the stump, right? So this would be the kind of aerial view. And you can see there. So you've got the disc, so a nice circle or that oval. You have the inner kind of jelly-like substance. We call this a nucleus propulsus. And then you have the outer ring, that little bit darker blue. That's called the annulus fibrosus. It's kind of like a little bit of a thicker sort of wicker weave fibers on the outside that sort of hold the material inside. All right. And then you've got the nerve, the spinal cord right down the center, and the bone. So that little spike down the back is just the ridges that you feel on your back. All right. So just so you know basic anatomy here. And let's talk about disc protrusion first. So you can see it, you have a broad-based or a focal herniation. And the protrusion that's more focal, you can see it involves less than 25% of the disc circumference, meaning it's just a small little kind of bulge there. All right. And you can see that the broad base is more broad. Pretty straightforward, right? And you can see a disc protrusion next to a disc extrusion, which is a little bit more severe, right? And really, some simple way to think about it is that the base is wider than the herniation in a protrusion. So you can see at the protrusion, the base is really wide, but the apex is not very wide. So the base is wider. In the extrusion, right, starts off with a small base, but then it kind of gets fatter and it grows. So the base is more narrow than the actual herniation. And this is an extrusion. It's kind of how you differ between the two. And an extrusion is a little bit different too, because the disc material actually escapes from the disc through a crack in the disc. All right. The protrusion, it's still contained. So the outer fibers of the disc are still sort of intact, but it's contained. So there's no sort of jelly outside of the donut. Again, if you have heard of that analogy. Disc sequestration is sort of as bad as it gets, right? So the disc material has escaped from the disc and broken away from the disc, become a free disc fragment or a free floating fragment. So you can see from the side, it's sort of like a little teardrop, right? And so it's an extrusion essentially that has come out and sort of separated from the disc. And so now that you know what disc herniations are, sort of what they look like and the different types, I've got a quick question for you. So if you had to pick, which herniation do you think would be least likely to heal naturally without surgery? So again, here are 4 stages of disc herniation. We kind of talked about the prolapse or protrusion, the extrusion, and sequestration. Most people will be like, wow, that's really bad. Like, I don't want that, right? The chance that that's going to get better is not good. But this simply isn't true, and I need to let you in on that. So in fact, an interesting study published years ago found that the majority of disc herniations not only just heal with time and the right natural treatment, but really, this is the important thing, that the more severe the herniation, the better chances that you can heal without surgery. Pretty crazy, right? So this herniation, the sequestration, as well as the extrusion, yes, they hurt and they're painful, but the chance that you're going to heal without surgery is better for these than, say, the degenerative disc or the protrusion. So here's specifically what was found for each type of disc herniation. So the rate of spontaneous regression, they call it, or essentially shrinkage or reabsorption or healing, for lack of better terms, was found to be 96% for disc sequestration. So for that one, right, 96% chance that thing's going to reabsorb. For extrusion, the next one, they found 70%, 41% for disc protrusions, and 13% for disc bulges. So again, the bigger the bulge or herniation, the better your chances of not needing surgery and healing naturally. So I don't know what you've been told, but most people are told, hey, this is really bad. Like, things look really bad. It freaks the heck out of them. I get it. It's a scary time, but you can solve this, and you can absolutely solve it naturally, all right? And it's pretty amazing. Human body is amazing at healing. So just like every other tissue or part of the body, discs heal. In fact, most do so within 6 months. And if you think about it, it just makes sense that discs heal. So bones heal within 2 to 3 months. So if you break your bone, you break your femur, the biggest bone there is in the body, right? Have some gnarly crash or fall off a bike or whatever, right? 2 to 3 months, you're going to be better. Muscles, 4-ish weeks. Ligaments, 2 to 3 months. Tendon, 3 to 6 months. Cartilage, 12 weeks-ish, so a few months there. But discs, you were told that you're going to have to live with it and it's never going to get better. No, that doesn't make any sense. Does your body say like, hey, we'll heal your bones, we'll heal your muscles, we'll heal your cuts, we'll heal everything else, all your bruises, they'll go away, but we don't like your discs? No, it doesn't make sense, right? And there's plenty of proof. So since so many professionals and people use their images, x-rays and MRIs as proof that their spine is damaged, literally people send me them every day and say like, look, I'm telling you, this is what's wrong. I get it. But I want to share with you an MRI of the same person's spine taken 6 months apart after a massive disc herniation. No surgery, no nothing. So here they are on the left, right? This is not good. Bad disc herniation. Then you have on the right, 6 months later, natural treatment, nothing. You can tell it's significantly shrunk. In fact, it's basically gone. Just kind of the slice of the MRI shows that it looks like there's maybe something there, but it's gone. So remember back to this, right? This thumbnail of the surgeon posting saying, this is bad. Actually, this is not bad. And this will heal because here it is. You actually want that if you have a disc problem, okay? So now let's go back for a moment and revisit this slide. I said the rate of spontaneous regression or shrinkage or reabsorption or healing was found to be really good for these disc sequestrations, extrusions. But what about these? 41%, Charlie, for disc protrusions and 13% for disc bulges. What's up with that? So you might be thinking and sort of stuck on the stats here, right? And be wondering like, well, what about folks with disc protrusions or bulges? It looks like they don't really get better. So here's the good news about these stats. So you can see here at the top, imaging findings, right? And these are in folks who have no pain, asymptomatic patients at the very top. You can see that, hopefully. The idea is that, look, at 20 years old, 30% of people are going to have disc bulges, 29, essentially 30% will have protrusions. At 30, 40% of people have no pain at all have disc bulges, 31% have protrusions. At 40, and the numbers just keep going up to the point where, hey, at 60 years old, 69% of folks have disc bulges, almost 40 have protrusions, and they feel nothing. So they are just so common. Disc degeneration is even more common. You're 50 years old, 80% chance that if you get an image, you're going to have that DDD, degenerative disc disease. Disc height loss. So many people get images and they're like, well, I saw it. Like there's very little room. There's very little space between my bones because my disc is gone. Disc desiccation. You have it from 20 on. It's normal. So it's normal to have disc bulges, protrusion, shrinking disc, degeneration, all kinds of other things. And just like wrinkles on the skin, think of it like that. Wrinkles on the skin are changes. They don't look the best, but they don't hurt, right? They're just normal. So changes your bones, your joints and discs are normal, and they don't have to hurt, and they should be expected. So this is why x-rays and MRIs are not recommended for most back pain, because everyone has something wrong with them, and it's often impossible to distinguish between normal and abnormal stuff. Unfortunately, though, if you don't know this, and this is why I'm sharing it, then you'll take the results of your image as proof that something is wrong with you and the reason why you hurt, and you'll actually resist healing. Your brain will get stuck in a mental trap, a negative feedback loop because of what you believe. And one final thing that people want to know is, okay, cool, Charlie, I hear what you're saying. Great, these things can heal, but how do they heal? And really super simple answer is this, like, just like everything else in your body heals. Again, your body doesn't think about it like this, right? It doesn't just say, okay, I'll heal your cuts, I'll heal everything else, right? You've never thought about how those things heal. They just heal. But now you're questioning whether or not your disc will heal. Of course it will. It's just a tissue in the body. And there's a few phases to kind of natural healing, right? And I won't go crazy into this, but big picture, you've got 3, you could argue, maybe some folks say 4, but 3 phases. Inflammation phase. So the injury happens. An inflammatory event is sort of initiated, which signals to the body, hey, protect the area and send special healing cells to the region. Then you have this proliferation phase. It's basically a fancy way of saying, hey, the injured area needs to sort of be rebuilt. And then you have the remodeling phase or the maturation phase. Things become mature and that scar tissue strengthens and the final stage of healing occurs. So sort of like a cut heals, it bleeds, it stops bleeding, a scab forms, it falls off. You don't even think about it and your skin heals up and you move on with life. That's the same thing that happens with discs. So there's some other theories, right, as to how these discs heal on top of just sort of the normal process. So number one, kind of theorize that, hey, maybe the disc just retracts to its original position, right? Sort of like a balloon that when you squeeze it kind of bulges out one end, but then when you stop squeezing it, right, the bulge disappears. Or maybe the herniation is reduced through dehydration. So the disc material, which is essentially outside of the disc, basically dries up, gets absorbed, and the disc heals up. And here's one way that I sort of theorize or put that sort of natural inflammatory proliferation, remodeling sort of process of how the body heals naturally into an analogy, right? So this is kind of how I theorize or make sense of how these massive disc herniations heal so well. And again, just hang in there with me. It's sort of a little different. So if you've done any research online, there's no shortage of folks referring to these discs as jelly donuts, and that disc herniations are sort of likened to or equivalent to the jelly coming or squirting out of the donut. Again, scary language. So I don't think it's the best analogy because there's nothing more frightening than picturing the jelly literally coming out of your disc, all right, or the donut. So, but look, this is such a common analogy and it's likely you've heard it before. So I'm going to put a positive spin on it, all right, and hopefully create some sense of humor out of it. All right, so here we go. So imagine you're an ant, right? And like most ants, you love sweet things. So let's just say jelly, right? And you're walking down the sidewalk when you notice two jelly donuts. So one donut looks like this. And it's a perfect donut, right? They sold you this donut. They say there's jelly in it, but you're like looking for the hole because you usually see a little poke hole, some jelly out. You don't even see that. This thing is perfect. And the other donut looks like this. Jelly's just oozing out, right? Again, it looks like somebody ate it, but I don't know what happened there, but jelly is oozing out. So which do you and your ant friends prefer? I kind of went back to how they sold you the donut, but I forgot I was an ant. Okay, so let's just keep moving with the ant analogy. Okay, so look, I could be wrong because I am not an ant, but the one that's oozing jelly seems to be a quicker, easier, and probably equally as tasty treat. Why? Because getting to the jelly of the first donut is hard, right? It takes a lot of time, requires that, as an ant, I chew through that breading, and I have to do that to first get to sort of the sweet stuff, right? The jelly. So there's a delayed satisfaction, if you will. And that's just, again, a waste of valuable time and energy. I'm going to have to call a lot of my friends. I'm going to be working like half the day just to chew through it. So let's get straight to the jelly. So what's the point I'm trying to make? The more severe the disc herniation, the more easily the body, or the ants, right, if you're still in ant mode, can reabsorb the material because the jelly is exposed and outside the disc. If I'm an ant, I just walk up and I start gobbling that thing up. So this way, healing cells, or again, ants sort of a liken to that, right, can come and clean up things more quickly and you can get on with your life. So look, it's just the way I think about it, okay? Take it as it is, but it sort of makes sense when you think about the stages of healing and how the body heals. And what this all means at the end of the day is that disc herniations do heal and that you should not be scared of your imaging findings because oftentimes the findings are a normal part of life and don't carry much meaning behind them. This is why I'm not an advocate of them for most things. If you think you have a fracture, if you think you have an infection, if you think you have a tumor, yeah, go do it, but not as the first step. In fact, in this case, the worse the injury, the better. So the next time someone tells you that you've herniated a disc and it can't heal, or that you'll have to live with this problem forever, it simply isn't true. And I would challenge them. Send them this. Pull up this research. I have it here in a moment, some of the resources. And look, I just checked my inbox a little bit before shooting this, and I just got this message, right? I was checking in with a viewer that I had consulted with initially, and I wanted to see how he was doing. So he wrote me this message. He says, "Charlie, hi, I got some scary results. Literally scared of the results of his image. And now I'm getting an appointment to meet with a spine specialist. Also, I'm getting a copy of the images soon. Feel free to review my report. It means a lot that you're checking in on me." So here they were, right? So he's 24 years old. This is crazy. Impression: mild central disc protrusion. Mild. No spinal canal stenosis. Great spine. Mild to moderate neuroforaminal holes where the nerves exit. Foraminal narrowing on the right to L4, L5, and bilaterally L5, S1. Normal stuff, folks. I'm telling you, normal stuff. You're going to be fine if you're watching this. So I get messages like this every day, and quite frankly, it pisses me off, and it's sad. This is just another person, a very young person at that, right? Trapped by the results of their MRI and headed down the path of seeing a spine specialist, a specialist at doing surgery and injections, and maybe prescribing pills. But if that's not what you want, and you want to solve this naturally, don't do it. When all they really need, or this person needs, and the woman I chatted with, is some education, reassurance, and a good plan to solve things naturally. I'm not saying that you can't take pills or get shots or get surgery, but there's only 4 ways to solve this: pill, shot, surgery, or motion. You need to look within. You can absolutely solve this problem if you have the right tools, knowledge, and education, as well as some access to resources, okay? Pill, shot, surgery, they can work. I'm not saying they can't. So if you're watching and saying, "I had surgery, I did great," awesome. But the truth is that the outcomes are not very good. And they don't actually address why the problem started to begin with. If you get spine surgery and you are placing yourself in a yucky environment, mentally or physically, and your body and your brain is not optimized for healing, And every day you pick things up and put things down for your work, right? And you don't have strategies to make sure you're doing that in a way that's most efficient. And you don't have this base knowledge to understand what really pain is and the negative feedback loop that you get stuck in. Then you can do all the surgeries you want, but you're going to go right back into that lifestyle and it's going to come back. So you can solve this problem naturally. You can either go to someone and have them move you, or you can learn to move yourself. I'm a proponent of someone who teaches you to move yourself. I love teaching people how to use movement in the mind as medicine. Why? Because I used to be the person who would fix people. So I was trained by osteopaths. I used to teach at the University of Southern California. There's nothing wrong with that approach. I used to do all kinds of hands-on stuff. But I found that I was good at fixing people in the moment, but they kept coming back for the same problems because I wasn't giving them the tools, knowledge, and understanding and resources to solve it on their own. So yes, is there accountability? Yes. Is there work? Yes, but there's work involved. You've got to drive back and forth to these things. Instead, spend that time where you would normally go and rely on someone else to fix you and learn to fix yourself. You can do it. All right. So that's all for now. Hopefully this lesson helps. Again, if you want to avoid MRI, check out my DIY diagnostic guide. You can probably get some really good information about what could be going on there. Actually, I know you can. I put a ton of time and effort into that. Also, if you need help, okay, you can check out some of the links below for how you can connect with me. Like, comment this video as well. If you have any questions or comments, would love to get back to you, and be sure that you hit subscribe for more like videos in the future. Thanks so much, everyone. Until next time, chat soon. And in case you're wondering, here are the resources and some things if you want to check out the literature I referred to during this lesson.